So for a crown prep procedure, we're always going to need the crown consent. You're going to give this to the patient before we start the procedure, and you're going to have them read through, put their name, the tooth numbers, you have to put that in there, and then usually we're going to have to get the dentist to sign it and the patient to sign it. And then after that, usually during the procedure, we're going to put the topical on the area, and we're just gonna swirl it in there and put it on the area where the crown is going to be prepped and numb that up. And then the doctor will come in with the needle, so make sure you have that set up and numb that fully. Before you do the topical, you're going to grab one of the trays. So this will be like the anterior area of the teeth or of the jaw, and then this is the posterior, which is the back teeth. And we're going to put the impression material, which is the medium body, onto the tray and take an impression before, so that when he preps the temporary crown, you have the impression, which is what he uses to make the temporary crown. So after that, the doctor will come in, and then he's going to use multiple things in the procedure. So for example, this is the medium body, I just talked about it. We're going to use this to make the impression. This is what the doctor uses to basically see which tooth he needs to prep for, and he uses this to make the crown. But this is the temporary crown material that he uses to make the temporary crown. This is Gluma. It usually is in this box, and it desensitizes the gums, so it basically, if they're inflamed, it like shrinks them. Then there's the cord, and he uses this to see the margins of the tooth, so he packs it around the tooth with the cord packer, so make sure you have that on hand. Then there's the Hemodent, and he usually uses the microfiber brushes to help stop bleeding. And then we have the Vaseline. This is what he uses for whenever he's putting the temporary crown on there. So when he makes the temporary crown, he has to line the tooth with some Vaseline so that this comes off easily. And then there's the Temp Bond, which he uses to temporarily put on the crown so that it doesn't fall out of the patient's mouth or anything like that. So basically it just temporarily sits on the tooth. And then we have the floss, which is usually used to just clean up the margin if there's any extra material around. And then there's the hemostat, which he uses to remove the tooth if he needs to, the temporary crown, of course. And then we also have the crown caddy, which has all the stuff that you need in it if you need any extra supplies. And of course, during the procedure, we take an impression before the procedure and then after the procedure, so that's why we have an extra tip here. But then over here, we're usually going to have our hand pieces, the high speed and the slow speed, and then we're also going to have a scaler here just in case he needs to clean up the area. That's pretty much it.